Health equity is assurance of the conditions for optimal health for all people, where assurance is a process, not an outcome. So we all have the goal, we share the goal of the attainment of the highest level of health for all people. But that, if that's how we think of health equity, what if we hit that last Sunday? Are we done? And health equity is not an outcome, it's a process, which process assurance, which is actually one of the three core functions of public health identified by the Institute of Medicine, along with assessment and policy development. Assurance of what? Of the conditions for optimal health. Those neighborhood factors that we talk about when we talk about the social determinants of health. And for whom? For all people. That makes it equity. Achieving health equity requires at least three things: valuing all individuals and populations equally, recognizing and rectifying historical injustices, and providing resources according to need. And my presidential initiative has been to launch the American Public Health Association and including our members, our affiliates, partners in other sectors, community members across the board in a national campaign against racism. The point of that being that we need to name racism as a threat to the health and well-being of the nation, say the whole word, racism. Don't stop at race or cultural competence or implicit bias. All of those are important things to talk about. But we need to name racism. Then we need to ask, how is racism operating here in my workplace, in our community, in my child's school? And when you ask that question, you're starting to look at structures, policies, practices, norms, values. These are all elements of decision-making. And then the third stage, you name racism, you ask, how is racism operating here? And then we need to organize and strategize to act.